Cystic fibrosis, what is it?
Cystic fibrosis is a condition in which there's a defect in the transport of sodium, and you get a lot of mucus collections in the lungs and in the pancreas. In the pancreas, it prevents you from having your digestive enzymes into the intestinal tract, so you don't absorb fat and carbohydrates. The stools are very big. Sometimes they're orange because of the malabsorption of fat. In the lungs, you tend to get a lot of bacterial infections because of all the mucus collections, and the main reason of death in cystic fibrosis is usually due to lung infections.
We now are screening newborns, and now they look for little markers, and sometimes they come back, you could have cystic fibrosis. How do you handle that? Does that mean you're going to have it, or do you need more further testing?
Further testing, the gold standard is still the sweat test. An abnormal, elevated sweat content will probably be the best screening test.
We also do know there are mild forms of cystic fibrosis. Sometimes you can live your full life and not even know you have it, or sometimes a kid has been labeled an asthmatic, and sometimes a good doctor will throw in a sweat test, and to his amazement, the kid really had cystic fibrosis. So it doesn't always present in the classical way. But as a GI nutritional expert, you're more involved in the malabsorption part. What is the hallmark of the malabsorption you'd be looking for?
Poor weight gain. They're not absorbing fat. They don't have the enzyme lipase.
Something unique about their stools, usually?
Yeah, they're big. They're bulky. They usually are. The color is usually orange because of the malabsorption of fat.
And they can float sometimes?
They float because of the grease. Yeah.
Can a baby be born and doesn't make a stool in the beginning, and you have some concern?
Yes, sometimes babies are born with cystic fibrosis and they don't have bowel movements for a while.
If you do have that diagnosis from the GI point of view, what do they usually give the kid to keep the kid gaining and thriving? What could you do?
They give them supplemental pancreatic enzymes, and these enzymes contain the enzymes to digest fat and the enzymes to digest carbohydrates and proteins. Also, you can give a child who with cystic fibrosis a formula in which the protein is already digested and the fat is most medium chain triglycerides.
Well, the example of that would be?
Progestamil, and progestamil probably is one of the highest in medium chain triglycerides where the fat's already absorbed.
So a regular formula would not be the ideal formula for a kid like this?
A regular formula would not be ideal because it doesn't have the fat profile.
Can a kid have just the GI component and not the lung component?
There are many different forms of cystic fibrosis.
Some get more GI component,
yes,
some get more lung component, some have both things at a high level.
Right.
Okay, if you were given that diagnosis to a child, the life expectancy years ago was very short, and what is it today?
The life expectancy today for the most severe form is in the 20s to 30s.
But a milder form with treatment?
40 to 50.
And some even longer if it's
yes.
really well controlled. And we don't really know if we're doing what we're going to have 40, 50 years from the treatment from today, because we have to wait 40 to 50 years.
The main thing that's helping kids survive today, the two main things are good nutrition and good lung care. As soon as they get a bacterial infection, you treat it, and you treat it aggressively because it's the bacterial infections that cause the destruction of the lungs and then harder breathing, and that affects